My name's Louise Parker. I'm a district nurse team leader, so I manage a team here at Bingley, a team of district nurses who provide care predominantly to housebound patients in the community. Melissa's a young 21-year-old girl who came into our care about 8-9 months ago now. She's a young lady with cerebral palsy and associated learning disabilities, and she's got a very, very complex physical health history.
A couple of us went and we'd distract Melissa, like singing songs and things like that.
Going nice and early on Christmas Day, not to spoil the rest of the day.
So not only just with Melissa, we also offered support to Julie, her mum as well. This was doing some teaching education with the complex invasive procedures, like we taught Julie how to flush the catheter.
They've rung us on a night to make sure we're both alright. They've rung us on a weekend when they've been off.
During the course of a few months in our care within the community, her care needs, indeed her life was threatened.
They spoke to the medical team who was very reluctant to operate, but there was no choice because she wouldn't have survived if they hadn't have, and if the district nurses hadn't have pushed it, then she might not be here today.
On the assessment and treatment unit, we have patients who have a learning disability and a mental health, adults 18 above. They come in for a course of assessment. We work with them in a person-centred way to treat them.
They give nice stuff and they take you out every day. They like painting activities and stuff.
As a team, everyone is compassionate in learning disabilities, and you can see that in the delivery of care that they do give the patients.
And we're dealing with really challenging environment. We have service users that, you know, they're constantly writing thank you letters and saying how we've supported them and helped them. And we've also got the facilities to try and get really deep down into the bottom of why they might be challenging community.
It's about keeping them safe, helping them discuss what issues they've got, stresses, and how we can manage them and overcome that.
Each and every member of the team gives over 100%. They're all committed, they come to work to really make a difference for patients who are entering the last year of life, and also the relatives.
We pull together to work as part of a wider team, really.
I think they just make a massive difference in sometimes quite small but really meaningful ways.
It's about having people around who are going to offer support and advice in terms of what's needed moving forward. The M&D Association talk about the right equipment in the right place at the right time, and I think that's key to it. But it's not just equipment; it's also about you as a person. What can we do to make this patient's experience as positive as possible?
It'd be very easy with this disease to just get really depressed all the time, and you need people to sort of make you feel good.
You only get one chance to get it right, and so it's so important that you're focused on that patient and on the family.
We meet lots of parents, we go into children's centres, schools, nurseries. We sign up parents for the fluoride varnish, so they have to fill in a consent form for their child to have the varnishing done, and then we get the children together with the staff and we apply the varnish to the teeth.
The fluoride varnish team have been coming for about 5 years, twice a year, to apply fluoride varnish to our children's teeth. It makes a massive difference because some of the children around here don't even have dentists, so for them to come and do that twice a year, it's really protecting the children's teeth.
We've now got 189 nurseries, children's centres and private day nurseries. We've got 159 primary schools. The programme is so busy and hectic.
They're making a massive difference to the children, particularly around here. They're really friendly, they put the children at ease.
My name is Ruth Wood. I'm an occupational therapist on the Dementia Assessment Unit. So this little lady is an empathy doll, and this gives back the caring role to our patients. So instead of being cared for, they're caring for others.
And the difference that it's made is quite amazing, because they don't look like a baby, but they're weighted like a small child. And the reaction that we get from our patients is amazing.
We try to be person-centred on the ward, and so we provided headphones which can have individual person's like of music on a SIM card. I bought some microphones so that families can record their own personal message to a patient.
The issue was Bracken Ward over at Airedale Centre for Mental Health. The heating had gone down. I think there was a leak in one of the pipes, and there was the estates team were on site trying to rectify that. What I had to do was basically fill up the food services vehicle with food, hot and cold food, hot and cold drinks, and then I got over to Airedale Centre for Mental Health and made sure people were fed and watered, staff and service users alike.
It was quite a challenging environment. There were a lot of things to take into consideration. There were people coming onto the ward who weren't familiar with the ward, both staff and patients.
So all the services all pulled together. We ourselves provided some food at short notice for everybody who was working, and also for the incoming service users.
Got all the linen and all the blankets and all the towels and made sure the rooms were fully stocked and clean.
I was actually on annual leave that night. Got a text asking if I could help out. Made my way over to Bracken Ward to bring the patients safely across.
We're the ones that are in the background that people don't see until something goes wrong.
It was a big team effort. It was a really good night. It was really positive to see that kind of reaction from staff and the service users.
What the Four Seasons Cafe means to me is a break from hospital routine. It's a chance to be in as near a normal environment as possible.
This cafe is about recovery, it's about bringing people together, it's about really breaking down the barriers between staff and service users. It's about having a non-medical environment where people can come together and relax off the wards or up from outpatients, and they can sit together and just relax. We want to put the Four Seasons on the map.
I like to talk to people, and I think having this cafe is a godsend.